I'd like to acknowledge all the frontline workers, all our nurses, for having the courage to get up every day and go to work without PPE, without vaccine, without any implementation for safety. Because at the end of the day, we saved New York. Nurses did. We saved a lot of patients. So the last year and a half has been a struggle for our members, for our community.
CDPH management administration decided to kick us while we're down, tired and weak from fighting the pandemic. As part of this restructure, many experienced nurses were forced into retirement.
No more profits before patients.
Kingston Hospital's nurses are fuming at Westchester Medical Group. Over 40 of their fellow hospital staff members were laid off by the corporation that runs Health Alliance and the hospital.
Save staffing! Save lives! Save staffing! Save lives! Save staffing! Save lives!
Do you want to continue to work on the med-surg floor where it's 1 to 7, 1 to 8, 1 to 9, and you're frustrated and you're burnt out and you're angry? Or do you want to take all those frustrations and anger and use it in a positive way by helping your colleagues to collect the data we need so that we can continue to fight and escalate the fight? It's not a one-person fight. It is a 42,000 person fight.
Save staffing! Now!
We are seeing people we've never seen before come through our doors. This is why we are advocating for safe staffing and looking to our local politicians and community leaders to enact the Safe Staffing for Quality Care Act.
Safe staffing saves lives! Safe staffing saves lives!
Nurses at Erie County Medical Center in Buffalo say they need more staff on virtually every floor of the hospital. Nurses rallied in front of the hospital Wednesday, calling on state legislators to pass the Safe Staffing for Quality Care Act.
We feel like we are forgotten. We feel like our patients have been forgotten.
New at 11, the New York State Nurses Association says more staffing is needed at Ellis Hospital. Nurses have filed nearly 300 complaints with management over the last 2 years.
We're constantly asked to do more with less, and it's getting increasingly harder.
We cannot continue to work in these conditions. We have been chronically short-staffed for years, and now things are 10 times worse after COVID. We need safe staffing to pass in the state government so that every patient in every hospital and every nursing home is protected by safe staffing standards.
Pass the bill! 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 Pass the bill!
Now, because of this pandemic, it is all the more urgent. It's actually still happening behind me, this rally. We're listening to some speakers. One of them just said it's time to stop calling them heroes when the hospitals they are working at, they are treated like zeros.
What do we want? Safe staffing! What do we want it? Now!
Methodist nurses rallied together today, fired up and demanding change, after they say they're so understaffed they've not only reached their breaking point, but say it's cost lives.
This is not a joke. These are people's lives.
That's why they want lawmakers to pass the Safe Staffing for Quality Care Act. Brooklyn Borough President Eric Adams also on board.
The role of a nurse is to provide care, not to sit in the hospital bed needing care because they're overworked.
The AG's team found New York's official nursing home COVID-19 death toll may be undercounted by approximately half because the state did not include nursing home residents who died off-site at hospitals.
One of the multiple issues raised in the Attorney General's report on nursing homes is staffing levels and how understaffed nursing homes put residents and workers at risk.
Through the darkest days of COVID, New York's nurses helped save more than 140,000 lives. With safe staffing, we could have saved thousands more. All nursing home residents and hospital patients should be protected by minimum staffing standards that apply to all facilities equally, regardless of their zip code. Quality care depends on having enough frontline nurses and caregivers. Tell Albany, pass safe staffing. Safe staffing saves lives. Paid for by the New York State Nurses Association.
Now we need every nurse, every NYSNA member, every nurse, private, public, union, non-union, to be involved with the staffing language and continue the fight. I am excited that now the hospitals will be held accountable for the short staffing. I am excited to be able to work with Department of Health and make sure that patient-nurse ratio will be posted. The public will also know what's going on in the hospital, what's going on with staffing. So that is a big victory for us.
I'm very proud that NYSNA is part of the New York Heroes Act because it mandates employers to make sure that workers, frontline workers, have the equipment that they need to work with, PPE, not only healthcare workers but laundromat workers, restaurant workers, and essential workers in New York.
Do the right thing. Pass legislation that will take care of all New Yorkers, especially our essential workers.
And our PPEs have been locked up and are rationed out and are reused. I think this is just abominable for any time.
We have to ask the question, how many more healthcare workers, transit workers, grocery store workers, Amazon workers, meatpacking workers, and other essential workers, how many more deaths is it going to take for there to be laws that get passed?
I chair the Climate and Environmental Justice Committee. Our goal is to educate nurses on how important climate is. We experienced Sandy, we experienced Maria in Puerto Rico, all the disasters. We educate our nurses on how important it is to really pay attention to our environment and how it affects our family, our patients, and our community.
From hypertension to asthma, our patient population is getting sicker. No one is going to tell me that climate change is not a public health crisis.
The fair funding will assist our safety net hospital to provide services and to provide resources for underserved communities.
We need to be out there. We need to continue to bargain, and that's what we're doing here at NYSNA. We are bargaining with the employer in order to make a safe environment for our members, not only for our members, for the patients, for our community.
While we fight for regulations that protect us from hazards, the very least we can do is to compensate us post-exposure for the tremendous losses we endure.
We are nurses. A nurse is to nurse, is to care for the community, whether it's a rich community, whether it's a poor community, whether it's a brown or black community. So as members, as nurses, when you're in the hospital, you see certain disparities. You see the patients coming in and you notice the difference between African American patients or Caucasian patients. You notice the high blood pressure, the diabetes, obesity. So we realize something is wrong. We are the community. We have to serve a community. How could I be a nurse and sit there and realize there's a disparity in healthcare and not say something and not do something about it? I have to.
Patient care! Patient care!
The majority of the people in this community are black and brown. Every patient deserves good quality health care, regardless of their zip code.
Moments in history that Black people have largely been written out of. It's time to turn that reflection into action, right? Because the way that we know that we truly honor and respect all these great leaders and their contributions is by continuing the work, and that's what we do. And that work is to stamp out systemic racism, to say no to austerity, and to really commit ourselves and our resources to the work that needs to be done to build a society where there truly is justice for all.
We have to make the most of Black History Month while at the same time fighting to integrate our studies, our histories, our experiences into the whole spectrum of what it means to be here in the United States.
Instead of a recession, a she-cession, the unemployment rate for women as a result of the pandemic is much higher than men.
It's always great to join the hardworking members of this extraordinary union, and I thank its Social Justice and Civil Rights Committee for organizing this important event. May is supposed to be a time of joy and celebration for Asian Americans, but it's been anything but that. As many of you know, it's been a year of pain and struggle for the Asian American community. Asian Americans have been scapegoated for the outbreak of COVID-19, and that blame has created a spike in anti-Asian hate and violence here in New York and across the country. Those of Asian descent have been beaten, slashed, spat on, and even killed.
of the things we should have now recognized based on this pandemic is how fragile globalization has made our economies and our countries. And that we must recognize that health is not a direct good. It is a good indirectly, because if I don't take care of my health, it is going to affect the next person or the next country. And if you take care of yours, then it will impact how we survive and how we manage. And so I think we need to have consensus and solidarity.
We should always keep updated on what is going on with the issues with the different countries. And maybe as one, we can ask our governments to prioritize health. And one problem we are encountering now is the vaccine accessibility or equity. The vaccines can be made more available to all countries, especially the poor and developing countries.
Nurses are resilient and we bounce back. And the nurses, I really credit each and every healthcare worker and nurse that fought that pandemic throughout the surge of the pandemic.
During the worst of the pandemic, the bright spot was always us working together as nurses, us being there to support each other. We've gone through like the whole range of emotions, from like being scared, being fearful, being angry. And I think now we're just so burnt out and we're so tired. And I think people are looking for an escape. And I think it's such a critical time right now to not escape and to really use the emotions that we've had the past year to get fired up to make change.
I think one of the bright spots that came out of the pandemic is the fact that it really showed how strong a profession's voice can be when they're all united, and they're united in massive numbers. When you have 42,000 nurses across New York State screaming, we need PPE, we need PPE, we need safe staffing, we need safe staffing, it's going to be heard.
We should focus on all those positives that did occur during the pandemic and build on that to show the strength that we have as a union. As a whole, the nurses came together to support these really sick patients, and seeing the patients recover and go home and start to rebuild their lives is what really is a bright spot.
Just be happy that we have NYSNA to support us in these very difficult times. Nurses are really strong women and men, and let's keep this going. We're going to face it if we work together. I think nurses are really made to be resilient. Most of us are really survivors, and most of us could really handle difficult things, and that was one of it. And we don't really know what's going to go after this, but at least we already know to prepare ourselves in the future.
We're a powerful union, but the only way you can utilize the benefits of NYSNA is you must get involved. NYSNA is the voice of nurses, the voice of the underserved community, championing the way for a better healthcare system.
It is so imperative to be involved and to know what's happening at your level, and then also to join in on convention and to learn what's going on across the state.
I feel that the importance of the union behind you is what's the word? Priceless. There is no price tag you can put on that to know that you have the support of a union behind you.
Nursing is a compassionate profession, and we need to care for each other, our patients, and the community. We all need to come together to fight against the corporate agenda destroying the healthcare.
So we have to come together as one big, strong union, and it means you, them, they, me, all together.
I want us to work together to be one. whether you live upstate, whether you live downstate, whether you're from a rich hospital or poor hospital, we are one NYSNA, one goal. Our goal is to care for our patients. Our goal is to make sure our members are protected when they go to work and have a safe environment, and other to deliver proper, safe patient care. We are a strong union, and we want to continue to be strong and be even stronger.